the Asthma Action Plan, and medicines. An Asthma Action Plan is a written, individualized worksheet that shows you the steps to take to keep a child's asthma from getting worse. It also provides guidance on when to call the healthcare provider or when to go to the emergency room. In the resources section, you can find a sample Asthma Action Plan. The Asthma Action Plan can be printed off and given to the doctor to fill out. The Asthma Action Plan should include factors that make the asthma worse or asthma triggers, medicines that are taken to treat asthma with specific names of each medicine, medicines to take based on signs and symptoms, telephone numbers for an emergency contact, the parents' numbers, the healthcare provider's name. The Asthma Action Plan is divided into 3 zones: green, yellow, and red. We discussed them in a prior module. The green zone is where you would want the child to be on a daily basis. In this zone, the child will have no asthma symptoms and feel good. The child should continue to take long-term controller medicines even if he or she is feeling well. The yellow zone means that the child is experiencing asthma symptoms. This is where you have the child slow down. Follow the steps written in the Asthma Action Plan's yellow zone, which will keep the child's asthma symptoms from getting worse. Be prepared to know what to do if there are asthma symptoms. Quickly evaluate the situation. Never leave the child alone. Stop the child's activity. If the episode began after exposure to an allergen or irritant, remove the child from the allergen or irritant if possible. Help the child to be calm and in a comfortable position. Locate the child's prescribed quick relief inhaler medicine. Give 2 puffs of the quick relief inhaler medicine. Follow the Asthma Action Plan. Repeat the quick relief inhaler medicine in 20 minutes if the child is still having trouble breathing. The red zone means the child is experiencing severe asthma symptoms or an asthma flare-up. Follow the steps in the Asthma Action Plan to get immediate medical treatment if the symptoms do not improve. Call 911 if any of the following occur. If the child is struggling to breathe, talk, stay awake, has blue lips, or asks for an ambulance. If the child doesn't improve after 2 administrations of the quick relief medicine. Make sure you follow the Asthma Action Plan, as the directions may be different. If no quick relief medicine is available, or if the child's symptoms have not improved spontaneously, call 911. Or if you are just unsure what to do, call 911. It is easier to stay calm and keep the child calm if there's a plan of how to handle an asthma attack. Many times, noticing the signs and symptoms of asthma early, giving the rescue medicine in the yellow zone, can avoid an attack that gets severe and enters the red zone. Make sure that every child with asthma has an Asthma Action Plan. There are 5 rights to giving any medication. When giving asthma medications, make sure you are giving the medicine to the right child, that you have the right medication, the right dose, you are giving the right medicine at the right time, and you are giving the medicine the right way via the nebulizer or inhaler with a spacer and mask. Do not use one child's medicine for another child. Children, family members, and friends should not share inhalers. They may be the wrong medicine for them, the wrong strength, and it can be dangerous. This is a respiratory treatments guide that shows all of the different medications for asthma and other respiratory conditions like COPD. There are many red inhalers, and it's important to know this so you don't accidentally give the wrong medication. The name of the medication will be on the outside of the inhaler or on the canister of the inhaler. If you need to look at the name on the canister to make sure you're giving the correct medicine, you may have to pull the canister out of the inhaler. Please note that red inhalers can be rescue medicine like ProAir, but also can be steroid controller inhaler medicines like Elvesco, Flovent, and Qvar. Symbicort is also a red inhaler and found under the combination medications. The top line of inhalers on the left, right here, are all rescue inhalers or short-acting beta-agonist bronchodilators. And the rescue inhaler may be red, gray, blue, or green color. If a refill is obtained, know that the next albuterol inhaler that you get may be a different color. Look at the canister to make sure you have the correct rescue medication. The canister should say albuterol. As noted on the last slide, albuterol is rescue medication. It rescues a child from a tight squeeze of an asthma attack. It is sometimes called a quick reliever medicine because it works quickly to relieve symptoms. Albuterol works for a short period of time, lasting for 4 to 6 hours. Everybody with asthma should always have a rescue quick relief medicine available to them. Rescue medicine should only be given for asthma signs and symptoms unless otherwise noting it on the Asthma Action Plan. Sometimes, if exercise is a trigger, the doctor will write on the Asthma Action Plan that the child should obtain the albuterol rescue medicine 15 to 20 minutes before exercise. There are a few adverse effects of rescue medicines or albuterol. A child may get a rapid or irregular heartbeat, muscle tremors, or nervousness. Know that if a child starts having some asthma symptoms and goes into the yellow zone and you give albuterol, the child may have a harder time settling down if it's nap time or bedtime because of a fast heartbeat, feeling jitteriness, or nervousness. You may need to sit with the child and do a quiet activity. Now we're going to talk about the other kind of asthma medicine, controller, or also called steroid medication. The controller medication keeps the asthma under control. It works for 12 or more hours, reduces swelling and mucus in the airways. Relief of symptoms occurs after taking the medicine for several weeks. The steroid inhaler only sends a small amount of the medicine right where it needs to go, down into the lungs. It should be taken daily as prescribed, even without asthma symptoms. There are a few side effects to controller or steroid medications. The first is a yeast infection of the mouth. There can be throat irritation, hoarseness, or a skin rash. These side effects can be prevented by brushing a child's teeth after giving the steroid medication, or if the child is old enough, have them rinse their mouth out with water and make sure they spit it out. Wipe the face with a washcloth with water to remove the medicine from the face around the mouth if a nebulizer mask or mask with spacer is used. The medicine can also lighten the skin color of the mouth if the skin is not wiped after a treatment. The controller or the steroid inhaler medication should be taken when? This is a great question to ask yourself. Is it only when it's needed, every day, or just once a week? Remember that the controller medicine is taken every day to control asthma.